Hi, my name's Phil. I like to talk about politics, and as we approach winter, there is always extra pressure on our health service. And when that health service is badly undermined by the government, as it is at the moment, then those stresses can cause collapses in the provision. In this video, I'd like to talk about the dire prospects for this coming winter when the NHS hasn't even recovered from last year yet. But first, if you'd like to see more of my videos, then please subscribe to the channel and click the bell notification icon. So, according to the British Thoracic Society, hospitals put on what were termed overflow beds in order to cope with the extra demand last winter of a cold winter from people with dangerous breathing problems. 52% of hospitals have already started to do this, getting ready for the winter that is coming. That sounds fine, fair enough. But they say that 48% are still using the ones that they laid on last winter. The pressure never eased off enough to dispense with them later on in 2019. Doctors have said that there is likely to be a perfect storm of pressures this winter, which will mean that the NHS is facing its worst winter since it began over half a century ago. Part of the reason for this is that there wasn't a calmer summer in order to recover from the previous winter. Hospitals in England have the smallest number of beds on record, and NHS England have admitted that bed occupancy in July, August and September were the worst ever recorded. Some hospitals have already started to cancel operations and other consultations in order to stand any chance at all of making it through the winter without breaking apart at the seams. And it also explains something that I found a little odd last week. So about this time each year, the NHS rolls out its flu vaccinations for vulnerable people, generally the elderly, as well as healthcare workers. But I had a text from my GP surgery telling me to go and get a shot. And I thought, that's weird. That's never happened before. I'm not a vulnerable person. I'm not a healthcare worker. What's this about? I found it a little odd. And it seems that the reason for this is because the NHS have decided to roll out a much larger vaccination programme in order to reduce a bit of flu-related pressure on their hospitals this winter. So that's one mystery solved. And it's not just beds that are the problem. There's been massive understaffing in the NHS for a while. We are 43,000 nurses short. And that's not even the funding issue. We just can't recruit enough nurses. And Brexit had made the situation much, much worse. It's all very well Boris Johnson saying he's going to get 50,000 more nurses, even though just under 20,000 of them are all ones that are already working for the NHS. So really, he's talking about an extra 30,000 nurses. But if you can't, at the moment, recruit as many nurses as the government has already made provision for, what's the point of promising more? Where are they going to come from? We aren't training enough homegrown nurses because the government cut the funding on that. And we're chasing away foreign nurses due to the xenophobic attitude of people post-Brexit, as well as the xenophobic attitude of our current government. Not that xenophobia alone is responsible. The problem is that when you're 43,000 nurses short, you don't just turn patients away because you can't cope. That's not how care works. So you give the nurses you do have larger workloads, much larger. So then they become stretched and exhausted by it all, both physically due to the work, but also emotionally due to the fact that they know their patients aren't getting the care they should be. And that doesn't just mean their patients aren't as comfortable as they should be. Some of them will develop more serious illnesses. Some of them will die due to the fact they're not getting the care that they should be getting. And this is one of the reasons cited by many British nurses for leaving the profession. They cannot cope and are breaking themselves under the physical and emotional pressure of an impossible task. And so that impossible task gets much worse for the fewer and fewer remaining nurses, who are not being replenished by enough newly trained nurses because the government reduced the funding for training programmes. Now, a few months ago, the Royal College of Nursing announced that the numbers of training nurses is still continuing to fall. And remember that any students right now that are applying to nursing courses, I have a number of students that are applying to do nursing, they are not going to qualify for several years. So even if we were to miraculously recruit enough right now, they won't be ready for a few more years. But we're not recruiting enough right now, not even close to the number we need according to the RCN. That means that we can't possibly hope to have enough for many years to come. It actually just means that the shortages we already face become more severe. And this is what people need to bear in mind when Boris Johnson is promising more nurses. Where is he going to get them from? What is he going to do to achieve this? Recruit from overseas? His immigration plans make this even harder than now. And we don't recruit enough now. Are you going to say, oh, well, we need more British nurses? Okay, so he's going to get more people from Britain going on to nurse training courses, is he? Okay, right. We're already not filling up the places already funded. We're 43,000 nurses short. There are training courses with spaces galore that's already funded. Loads of spaces. If you want to be a nurse, you can apply. If you've got the qualifications, you'll get in. There's plenty of spaces. We can't get enough. Adding more spaces will make zero difference. How is he going to do it? The answer is quite simple. He isn't. He can't. His policies' aims do not make it possible. So not only don't we have enough beds to cope with a bad winter, but we don't have enough staff to provide adequate care either. And so this winter, where hospitals already haven't recovered since last winter, the NHS will fail to cope. This means that they'll still be on their arse next winter when the shortages will be even greater and the system will just simply collapse under the weight of Johnson's fat, incompetent arse. And that's not even talking about the price increases of several thousand% that the NHS will have to stump up for medicines from the US when our government signs Trump's trade deal. Even Dominic Raab, the Foreign Secretary, was saying, yeah, that's a thing. And on that point, I did see a cracking tweet with a statistic that just makes the whole thing hit home. So what this tweet did is it explained the numbers of people that have been made bankrupt due to medical bills every single year by nation. So let's go through them. Canada, 0. France, 0. The Netherlands, 0. Switzerland, 0. Japan, 0. Germany, 0. The United States, 800,000. 800,000 American citizens every year. The richest nation on earth every year go bankrupt because they get ill. Something that's not their fault. They get an injury or illness, not their fault. But they end up bankrupt because they cannot afford the medical care that they desperately need. Now, I don't know which country has the best healthcare system, the one that we should take inspiration from. The NHS rightly, viewed in a positive light around the world. But it could be better. And as I say, if you're looking to make it better, I do not know which country we should really be looking at for that inspiration. But I will tell you what, I certainly do know which one we should steer well clear of when it comes to their healthcare model. So that's the situation facing the NHS this winter, a crisis waiting perversely to hit hardest the demographic who will actually be voting for the party that is inflicting it. So I hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, then please click the Patreon link for details as well. And until next time, I'll see you later.